In a way, this is where motivational interviewing started. The the idea of resistance that we believed at the time that people with alcohol and drug problems just had this peculiar high level of resistance and defensiveness and something wrong with their personality and so on. And so clinicians naturally had the question of how do we deal with this? And this is the question that brought people to motivational interviewing workshops back in the 1990s. How can I deal with the most difficult, impossible, intransigent, resistant clients that I see, right? And that's where people coming to workshops wanted to go right away. They wanted to start learning motivational interviewing with the most difficult kinds of clients. And they were very willing to role play those clients. They would eagerly role play the most difficult, impossible people that they were seeing. And what we learned quickly was that there are no clients who are as difficult as those who are role played by therapists. Clients are just not actually that difficult. Uh, the therapists, of course, we're trying to, be as difficult as possible to learn how to do this. But Steve Rolnick and I, shown here coming down a roller coaster, by the way, called these people that were being role played by therapists the clients from hell, because there just are no clients quite that difficult. And we emphasize that motivational interviewing is not like wrestling. It's not like trying to defeat your opponent. It's more like dancing together, moving together. And so that metaphor is one that appeared early. In fact, in our very first edition, we used the phrase roll with resistance, thinking of jujitsu or other martial arts analogies. But I think that was an unfortunate choice because it's still an adversarial metaphor. You're still trying to defeat your opponent. And so we've learned some things since then. And one important thing was these were things in our first and second edition that we were calling resistance. Now, these are all about cigarette smoking, but clients might say, I don't want to quit smoking. I don't think I can do it. I need to smoke in order to be able to relax. I don't need to quit. I don't have to quit. I'm not ready to quit. I'm not going to quit. Or I bought 4 cartons of cigarettes today. And our colleague and friend Terry Moyers said, most of what you guys are calling resistance in your 2 editions of the book is just sustained talk. It's just one half of clients' ambivalence. And there's nothing unusual about that. Why are you calling that resistance? And she was right. We realized that we had made a mistake with that. And it raised the interesting question, suppose you're to take what therapists mean by resistance and subtract sustained talk. Is there anything else left? Is there something else? And indeed, we found that there was. Here are some examples. You're not listening to me. You don't understand how hard this is for me. You don't really care about me. How old are you? This is something that clients would ask the young therapists in our clinic. How old are you? That's none of your business. Nobody can tell me what to do. Now, those are different. They just sound different than the things that were on the previous slide. And we call those discord. So what's discord? A discord is something that client is saying to you that signals that there's some uncomfort, there's some dissonance in your working relationship. And notice that most of those statements contain the word you. Just to go back for a minute here, you don't see the word you in sustained talk usually. It's more I don't want to quit. I need to quit smoking and so forth. But when you get into Discord, often the word you is there. You don't understand me. You're not listening to me. It's none of your business, you know. So interesting. It's a little different. And I used a musical analogy. I'm a musician also. You'd have to have two notes for there to be discord. One note doesn't sound like discord, but two notes right next to each other, then you can hear the dissonance or the discord in that. So what are we talking about here? It's still observable behavior. It's still something the client is doing, and it's interpersonal behavior. There have to be two people there for there to be discord, you know. And same thing for resistance. You know, nobody stands alone on the beach and resists. You know, there has to be someone else there that you're interacting with. So it's interpersonal behavior. Discord is, as I said, a sign of there being discomfort or dissonance or just something difficult in your working relationship at the moment. And so it's your client commenting to you about your relationship. You know, we're not dancing together well. You're stepping on my feet, you know, that sort of analogy. And by the way, like sustain talk, Discord predicts clients not changing. So if you're getting a lot of that, you're moving in the wrong direction because that's signaling the client is not going to be changing. So what are some signals of discord? This is from some old work in the 1980s by Jerry Patterson's group, and it still applies. Defensiveness, clients starting to push back against you and get defensive and or arguing with you, challenging you. You know, you don't know what you're talking about. Just hostility toward you even. An interesting one is your client is talking at the same time that you're talking. So while you're speaking, the client is speaking on top of you. Now, at least some Americans do that habitually, but if that's not their usual pattern, if you notice suddenly your client is talking while you're talking, that's a signal that you need to pay attention to, that there's something going on here. And then finally, just ignoring you, not paying attention to you, changing the subject, talking about things that are unrelated and so forth. So all of those behaviors are kind of signals of discord. Now, why do we call those things resistance? And as of our third edition, we suggested that we should stop using the word resistance because in a way, it's blaming the client for not changing. It's the client's fault, you know, that they're just here I am being a good counselor, being a good physician, being a good therapist, and you're resisting me. You know? And that can mean you're being intentionally difficult. You're doing this on purpose. Or at least in the addiction field, it often meant there's something wrong with the person. It's part of their pathology. We believed back in the 1980s and 90s that kind of defensiveness was actually a part of the pathology of addiction. It turns out it's a part of the way in which we are treating clients. Now, either way, if you're thinking the client's doing this on purpose, or this is something wrong with the client and that's why they're doing this, it's not the therapist's fault. You know, it's the client's problem. You know, where is it? Here's a study we did in 1993, and we compared two different counseling styles for giving feedback to people about their drinking. You know? And one style was kind of directive and confrontive, you know, and the other style was sort of supportive and reflective. So in a way, the difference is what do you do when the client disagrees with you? You know, how do you respond to that? For example, we would calculate how much they were drinking in a typical week and compare that to national averages. And we might say to them, you're at the 93rd percent, 98th, usually 98th percentile. That is, you're drinking more than 98% of American men. Now, very often clients say, "Well, that can't be right. All my friends drink like I do, whatever." How do you respond to that? In a sort of confrontive directive style, you would say, "Well, no, that's actually right. You and I sat here and we added up, remember, we added up all the drinks you were having, and we calculated how many standard drinks that is. And here are the normative data, and you actually are drinking at the 98th percentile." So you're trying to persuade, educate the client. In a supportive reflective style, and the client says, "That can't be right," how would you respond to that? You say that, this surprises you. It doesn't make sense to you. And you listen to the client some more. So we were comparing those two different counseling styles. What we noticed was clients were behaving very differently depending on which counseling style. Now, the green bars here are change talk. This is the client saying things that indicate that, yes, there's a problem here, and yes, they're thinking about changing. And the red bars are resistant behaviors. In the directive style, we were getting 50-50. We were getting just as much resistance as we were getting change talk. And that's a definition of ambivalence, and predicts not changing. In the listening, empathic, motivational interviewing style, we're getting 3 times more change talk than resistance. Now, these are the same counselors doing both styles. And the difference was in what they were doing and how clients respond to them. So how much change talk you're getting and how much resistance you're getting depends on what you're doing. In fact, we found that we could predict from one counselor behavior how much clients would be drinking. And that behavior was confronting. The more the counselor confronted, the more the client was drinking 6 months later, a year later. So confronting directly related to a bad outcome. You remember this graph that I showed you also, where we had counselors change their style every 12 minutes. So now it's the same counselor and the same clients, but just doing something different. And during the motivational interviewing segments, you get much more change talk than resistance or sustained talk. But then in the alternative style, which, as I explained, was functional analysis, then it reverses and it looks much more like ambivalence. So the balance of these two things is very much a function of what you're doing. And remember that it's the ratio of change talk to sustained talk we find that predicts whether change is going to happen. So the more change talk outnumbers the sustained talk, the more likely it is that change is going to happen. And that's under the influence of the counselor. So is resistance a client problem, as we thought it was back in the 1980s? Or is it a therapist skill issue? Well, as of the 3rd edition, and then continuing in the 4th edition of our book, we deconstructed the idea of resistance and suggested we no longer use it. Think about it. I mean, when you feel like the client's resisting you, what's going on here? But that's interpersonal behavior. And we said resistance, what is called resistance, actually, some of it is sustained talk, which is perfectly normal. And some of it is discord. It's the client saying, we're not dancing together well. I'm not comfortable here. Sustained talk is about the change you're focusing on, the target behavior. So, for example, I really don't want to stop smoking. That's sustained talk about smoking. I have to have my pills to make it through the day. I mean, so this is just the client talking about the change that you're considering. Discord's about your relationship. You can't make me quit. You don't understand how hard it is for me. And both of these are occurring in an interpersonal context and are highly responsive to what you do as a counselor. So How do you respond when you hear sustained talk and discord? And that continues to be an important part of motivational interviewing. We just don't call it resistance any longer because that's kind of blaming the client. Well, in a way, the easiest thing to do, the easiest way to respond to sustained talk and discord is with a reflection. And we've talked about several kinds, a simple or complex reflection, or an amplified reflection, or a double-sided reflection. So all of these reflecting what the client has just said to you. For example, complex reflections. That's so unfair, says the client. It just doesn't seem right to you. An empathic reflection. I really don't need to quit drinking, a client says. It doesn't seem important to you. A reflection. I can't believe you said that. You're upset with me. So you're paying attention to what the client's communicating to you and just reflecting it back. And in a way, that's the easiest way to respond to both sustained talk and discord. And it tends to soften it. It tends to kind of take the wind out of the sails, if you will, to take the steam out of it. And sometimes the client even then responds with the other side of their ambivalence. You're not listening to me. You really want me to hear you. Reflective responses, the very thing we've been talking about. How about an amplified reflection? This is where you reflect what the client says, but you increase the volume on it. You just kind of make it a little more intense. I can't believe you said that, client says to you. You're furious with me. Overstating it. Clients tend to say, well, I mean, no, but, and they'll tell you some more. You don't have children. What do you know? There's absolutely no way I could understand. Now, you can preface these things with, it seems like, or it sounds, as you see it. You really don't have to do that. I mean, it can be just, there's absolutely no way I could understand. And the client will respond to you. And then they tend to back away a little bit from what they were saying. I don't have an alcohol problem. Drinking's never caused you any trouble. A little more intense than what they were saying. And typically clients say, well, no, I mean, I certainly have had trouble when I've been drinking. I don't need anger management. People need to stop pissing me off. Actually, something my son said to me once. It's completely their fault. Again, you can preface it. Sometimes we feel like we need to preface it so they don't think we're agreeing with them or something. That doesn't usually happen, but you can preface it if you want. As you see it, it's completely their fault. How about a double-sided reflection? Client who's recovering from a heart attack says, I don't want to have another heart attack, but the amount of exercise that you're suggesting just doesn't fit into my life. I have a busy job. I'm a single parent. I hardly have any time for myself as it is. I'm taking your medication. I know it'd be good for me to be more active, but I just don't have the time. There's a little change talk in there. Right? Double-sided reflection. It's hard to imagine how you could add any exercise to your schedule, even though you know it would improve your health and help prevent another heart attack. Even though, or but, or although, I mean, you have something in the middle that kind of indicates the transition. You put the sustained talk first. Hard to imagine how you could add any exercise to your schedule. But, although, and, it could improve your health and would prevent another heart attack. Clients are likely to then give you a little bit of change talk here. If you reverse the order, by the way, if you put the change talk first, we talked about this before, You know it would improve your health and help prevent another heart attack, but it's hard to imagine how you could add any exercise to your schedule. Then they'll tell you why it's hard for them to add any exercise to their schedule. People tend to respond to the last thing you said. So three different kinds of reflection. Just a straightforward complex reflection, an amplified reflection, a double-sided reflection. What we found, by the way, is that when you behave with clients the way we've been talking about for the last 8 sessions, in an empathic, understanding, reflective, interested, engaged way, you don't get as much resistance. It just isn't so much a problem. So in the beginning, when people wanted to start with dealing with resistance, that's actually the wrong place to start. You start by learning how to listen and how to respond to people and how to invite their own change talk, how to do engaging and focusing and evoking. And when you do that, you just don't see so much resistance because these are interpersonal behaviors. So now in preparation for practice 14, I want you to take a few minutes here and think about, in your own experience, in situations that you've been in, or in your own work situation, or scenarios that you've observed, what are some resistant things that clients say to you? What are some resistant things that you hear? Now you'll need to think of what's the particular context. So where am I working here? Is this a smoking cessation clinic? Is this a mental health clinic? Is this a general medical practice? Am I coaching someone in athletics? I mean, what's the context? So you have a particular context in mind. And then write down now 4 or 5 examples of things that clients can say to you that just feel resistant. They just feel like it's pushing back against you or not going in the right direction. And you're going to need those examples for this exercise. So I'll give you a few minutes now just to reflect on this, to think of a particular context, and then begin to write down resistant things or sustained talk or discord that you could hear in that context, with clients offering those statements back to the person who's trying to help them. So 4 or 5 examples, please. If it helps, these are things a client might say to you that annoy you or make you want to disagree or prompt you to try to persuade the person, that are pulling pushback from you also. Okay, I hope that's been enough time for you to write down some good examples that you can use in this practice exercise. And this exercise we call batting practice. Now, for me, that means baseball, but I think for you, that probably means cricket. Yeah. Either way, there's a ball coming at them, and you're trying to connect your bat with it. So that's the idea here. How do you respond to sustained talk and discord? I'm not as familiar with cricket language, but I've picked up some of it from Steve Rolnick at least. So each person will take one turn at bat, and each batter will work with one bowler who's going to give them 3 pitches or three balls, 3 client statements, to which you respond with a reflection. And I'll demonstrate that first for you, just to give you an example. And for that, I just need someone who's willing to give me 3 of the examples from that you just wrote down. And I'll do my best to respond with some kind of reflective response, whether it's a sustained talk or discord, but I'll try to respond with maybe a simple reflection, a complex reflection, an amplified reflection, a double-sided reflection, some way. All I'm doing is just reflecting back to the person the very thing that they have said to me. So we've got a facilitator, That does help things go along. And we're only taking 15 minutes, so this is not a long one. And the facilitator is going to appoint pairs of people. So we'll say, well, you'll be the batter and you'll be the bowler this time, you know. And by the way, the facilitator can also take a turn at bat if they want to, but you're going to be appointing pairs. You, the facilitator, will be appointing pairs. So just pick two people. You're the batter, you're the bowler. And the batter will respond to three pitches, bowls, balls, whatever you call them, three responses from the person. And all you have to do is give one reflection. You don't have to give three. And it can be simple, it can be complex, it can be amplified, it can be double-sided, whatever. And just get a little wood on it. It doesn't have to be perfect. Just give it a try. And after you've responded to three of these pitches or bowls or balls, then it's somebody else's turn. So now the facilitator will appoint a new batter and a new bowler, and have fun with it. And you might have time for 6 rounds like this, six batters and bowlers. And I plan to have a second practice where if you didn't get a chance to be the batter this time, you can get a chance next time. But we've got 12 people plus a facilitator to keep things moving along. And again, don't worry about making it perfect. Just get a little wood on it. Just give it a try. And this is harder than it looks in the beginning, at least. So I think we're ready at this point then to go ahead and go into our breakout rooms for 15 minutes and have a little batting practice. Okay, I hope you had fun with that. That's how it's supposed to be. Not a pressure, not a competition, but just trying things out, which is the way motivational interviewing is. You're trying different things from our menu of strategies and immediately see how the client responds to it. Now, there's some other ways to respond to sustained talk and discord besides reflection. I find reflection is the easiest, but there are other things you can do. And a really good one is emphasizing choice, emphasizing the person's freedom to decide what they're going to do. And you're just telling the truth there because people do indeed decide what they're going to do, no matter what we tell them. For example, nobody can decide that for you. I don't want to stop smoking, and nobody can decide that for you. It's just the truth. It really is up to you. Again, the truth. You have some options here. It's implying that the person has some choices that they could pursue. I wonder what you'll choose to do. Here you're adding your own curiosity to it. And again, you're emphasizing that the person's it's their choice. I really don't want to do this. Well, I wonder what you'll choose to do. And again, it matters how you say it, the music in your voice, the very same words can sound supportive and empathic or matter of fact. It can sound sarcastic and dismissive. It can sound warning and threatening. So we do a lot with our voices besides the words that we speak, and that matters, and it will affect how clients respond. If you add some sarcasm to what you say, well, it really is up to you. You get a whole different response. How about apologizing? You don't apologize for sustained talk. So if the person says, I really don't want to stop smoking, you don't say, oh, I'm sorry. But when it's discord, it can be appropriate. When they're commenting on discomfort in your relationship. You're not listening to me, says the client. I'm sorry, let me try again. Tell me what you want me to understand. Who are you to tell me what to do? Says the client. You're right. You're the one who decides what you're going to do. And I apologize if I sounded like a drill sergeant. Uh, it doesn't cost you anything to apologize. If you've stepped on someone's toes when you're dancing, you can say, "Oh, I'm sorry," you know. And the same thing here. If the client is taking offense or taking umbrage at what's happening, you can say, "Oh, sorry, I didn't mean to offend you." If you're on a particularly touchy, hot topic, you can shift the focus, you can shift the topic to something else. Common one in my line of work is you calling me an alcoholic, you calling me an addict, you know. And this is what I usually said. Actually, I don't care about labels. What I care about is you and how these drugs or how you're drinking may be affecting your life and what, if anything, you might choose to do about it. So you're kind of shifting focus away from the labeling, this tense topic, and in my case, saying what was the truth about me. I don't care about labels. You know, that doesn't matter to me. What matters to me is you. Or if you're counseling a couple, doing some marital counseling, talking to people in a relationship with each other, one person's feeling defensive and says, "You're saying this is my fault?" You know, I would often say, blame just doesn't matter here. It's really irrelevant. This is not a courtroom to decide who's guilty. Let's focus instead on what you can do together to strengthen your relationship and be happier together as a couple. So that's a shifting focus strategy again, taking it away from the contentious topic to talk about something that we can move ahead together on. And then coming alongside, this is just connecting with what the person is saying. In a way, it's reflection. And you're not implying that you endorse what the person is saying. And that sometimes therapists are worried about that. Well, I think I'm agreeing with them. It really resembles an amplified reflection. If you're familiar with paradoxical intention in family systems, it's a little bit of the flavor here. But what always bothered me about that is you're trying to manipulate the client. You're trying to trick them into changing, and that's in a way the wrong mindset here. This is a straightforward joining response. So you might say if a person's talking about they just can't do this, well, maybe you're right. This is just too hard for you. This is just too difficult for you, no matter how important it is to change. You've come right alongside them and even added a little bit of intensity to it with no matter how important it is. Seems to you like you're going to have to keep on smoking regardless of the consequences. No sarcasm, no cynicism, just a statement of what seems to be the situation. And coming right alongside sometimes can get the person unstuck. It's again just something you try to see how the client responds. If you're working with a relationship, at least one person's being pretty pessimistic about it. So at this point, repairing your relationship is just really impossible. And the person tends to back away from it a bit. Not always. Sometimes they'll agree with you and say, "Yep, there's no hope." But you're trying different things to be able to move forward here. So this is from a motivational living workshop I was doing, and we had a physician there. His name was Cleve Sharp, an MD. And he said something during the workshop that really struck me. He said, I've been feeling like I'm sitting with a person and I'm talking about smoking or whatever it is. And it just feels to me like the defenses are this huge pile of rocks, and I just don't have time to take it down. I mean, we just don't have time in this context. And he said, and then I realized something. I don't have to worry about taking down the whole thing. I just have to remove a few rocks and not add any more, and then get out of the way, and the water will do the rest. thought, what a lovely image. And boy, there is some truth to that, that you don't have to solve the entire thing, but you just kind of move in the right direction. And coming alongside, maybe you're just removing one little rock, but maybe the water starts to come over and the person comes back to the next session and things have started to change. So I remembered Cleve's comment and I just thought that, this guy really touched on something here. So I think we have time for one more 15-minute batting practice. It's the same, you have the same group and the same facilitator. And the facilitator can appoint up to 6 new batters and bowlers. And again, if it's the facilitator wants to take a run at it, that's fine also. And again, you three tries just to respond in a reasonable way, and then your turn is over, and you go on to the next batter. And you're just making one response, and the bowler doesn't reply to that, and you're just trying out a response to see if you can come up with something that's a reasonable, am I consistent way of responding to this thing that the person has said. And again, just have fun with the creativity of it, so seeing what you can do. When I'm doing this live, we stand in a circle, and one person at a time is the batter, and anybody from the circle just kind of throws out responses, and it is great fun. A little trickier online, but I think it works. And now you have a bigger menu of options. You can still offer a simple reflection, or a little more complex reflection, or an amplified reflection, or a double-sided reflection. Or you can try this emphasizing choice, and it really is up to you. Nobody can make that choice for you. Sometimes I say, even if I wanted to, I can't make this decision for you. It is your choice. Or you can offer an apology if it feels like it's a discord kind of thing, and the person's sort of not happy about the way we're communicating. You can offer an apology and move on from there. If it's a hot topic, you can shift the focus to something else that you can talk about. And you can try coming alongside if you wish, which is sort of like an amplified reflection of what the person's been saying. Maybe it is just too hard for you. Maybe it is not going to work. And in seeming to agree with the person in the moment, then they can let go of their own stubbornness or their own fixation on this idea that they have. Again, it's just trying things out. In motivational interviewing, you've got this menu and quite a few more things, actually, that you can try, and just to see how the client responds. And what is this client going to respond to? You never know exactly. Which kind of open question will get some change talk from this person? You don't know until you try. The nice thing is you've got this range of options. And you just try things out, and you find out right away by watching the client how they respond to that. So that's where we are now with this practice exercise. Just the last practice for today. Just 15 minutes total. So go ahead into the breakout rooms and try a little batting practice again with a bigger menu. Okay, well, the next session will focus on the planning task and ways of offering information and advice, which is part of professional responsibility within an MI style. And so that's what we'll be taking up next week.